we're gonna try. We might try to bring the other one in if it will help us. With the back and forth. But thank you all for being here to talk about a really important broad subject of school safety. But I want to take 30 seconds, and I'm gonna just maybe take a bit of a different angle, because these are really weighty, serious subjects that we're talking about here today. But I want to say I've got five kids attending Fairfax County Public Schools, actually 4, one just graduated. You know, they go to school every day, and I want to choose my words carefully, but I never fear for their safety. I don't. Am I concerned as a parent? Yes. Am I concerned as a supervisor? Yes. But I just want everyone to be assured we have a phenomenal school system here with great procedures in place, great people working there. We have the best police force in the nation right here, and we got some folks here who are going to talk to us today. We have a great partner in Richmond with our Secretary of Public Safety. Thank you, Brian, for being here. So our kids are safe. Our communities are safe. We are the safest jurisdiction of our size in the country. So we always want to be vigilant and concerned, but we are so fortunate that compared to some places in the country where parents can't have that confidence of safety, I think we can. But it doesn't mean that that there's nothing out there to be concerned about. So I just want to make sure we had that sense of balance. Talk to our kids all the time about safety. Had a conversation yesterday with our kids. You want to be doing that as a parent, and we'll talk about that a little bit on the panel here. So let me introduce the folks here who are going to give you the knowledgeable information. I just get to ask the questions. So at the far end, Karen Keys-Gamerra from the Fairfax County School Board. Thank you, Karen, for being here. And then Peggy Cook. I'm going to skip over Francisco only because that's the order that they're on my paper. Peggy Cook is here. She is no relation to me. She is happy about that. But she is the Director of Residential Services at the Fairfax County Community Services Board. You may know the Community Services Board, which we're going to call the CSB today, because it saves us like 10 minutes of time throughout the day if we do that. That's the agency that handles drug addiction services, mental health, developmental disabilities, and they do a fantastic job. We have Francisco Duran here, who is the Chief Academic and Equity Officer, Fairfax County Public Schools, who I know has been very involved in these issues of making sure that our kids are all available for learning, right? Isn't that really what this is about? Is we want to make sure that we can get our kids in a position so that we're in the classroom, they're able to learn, despite whatever might be going on in their life and going on around them. And then Sergeant George Waked from the chief is up here too. Look at that, snuck in. Sergeant Waked from the narcotics squad is here, and then Chief Rossler, who the chief was on 1 or 2 other panels, but wanted to be on yet a 3rd, so he's up here. Thank you, Chief Rossler, for leading the effort here in Fairfax. Okay, so let's get started. I'm going to ask some questions, and then we're going to run the microphone back and forth. I'm going to start with Peggy. I lost that. What happened? I'm going to start with Peggy Cook, and I want to ask a little bit about the sort of laying the groundwork for opioids. But I will say this, that in Fairfax County we have somewhere around a dozen or so, give or take, homicides a year. And last year we had 113 opioid overdose deaths. This year we're at 35 as of yesterday, so a little off the pace, thank goodness. But so just to put this into scale, this overdose problem exceeds our homicide problem several-fold over. So Peggy, I'll give you the mic, and Peggy's going to talk a little bit about the source of opioids, which is not primarily gangs or bad people on the street, but our doctors and pediatricians and others who are for good reasons trying to help us, but it is, we have a problem with too many of these drugs.
Thank you for having me here. A few things to start out with. When I meet with parents, they often assume that they would know if their child would be using opiates, and that troubled children use opiates, but their child is getting good grades and is involved. And unfortunately, that's just not the case now. It's very mainstream, and we've seen that. I'm sure you have information from the youth survey from Fairfax County, and it does show that there's a number of children every month that are using opioids without a prescription. So the other main thing to talk about is that about 50% of the people that use opioids without a prescription start by using it from a family or a friend. So the good news about that is that it's a great opportunity to impact that. When I'm in groups like this, when I ask people, does anybody have some unused medicine in their medicine cabinet? Almost everybody raises their hands because they believe that it's important for other families to get rid of medicine. So that's one great way we can address the safety of our children. Get the information out there. There are some medication disposal bags that I've placed on the tables out there. And let's make sure our families know that that's an important first place to start. If we could reduce people beginning using by 50% by something so simple, seems like a good place to start for me.
Thank you, Peggy, and that is so true. 5% of our kids in school, actually 4.6 to be a little more exact, are using painkillers that are not their prescription drugs. So that's a fairly significant number of our students at any given time. I'm going to go to Karen Keys-Gamerra, our school board member, because our school board is on top of this. You've had discussions about this. Let's talk about sort of the general policy of how the school board's approaching the issue of opioids, and then we'll turn it over to Dr. Duran and get some of the specifics.
Thank you. Basically, we have included in our curriculum making sure that children understand the dangers of opioids and heroin use, as well as other substance abuse issues. The school board recently amended our policy with respect to how we were going to approach this, but we have the health instruction curriculum in grades 1 through 3. Students learn the importance of only taking medicine when it is given to them by their parents or a trusted adult. They are introduced to the effect of alcohol and smoking and what that effect may be on the body. In grades 4 through 6, we cover prescription and over-the-counter medications, the effect of alcohol, tobacco, inhalants and body systems and behavior, and refusal communication skills. The students then expand on earlier grade lessons, learning more sophisticated vocabulary and in greater detail about the effect of drugs, alcohol, and tobacco products on the body. In grades 7 through 8, we focus on alcohol, tobacco, marijuana, and healthy brain function, addiction, and the legal consequences. We have risk protective factors that we address, investigating different drugs. And students learn about addictive behavior and how addiction can lead to other chronic diseases such as addiction to alcohol and liver disease. In grades 9 through 12, we also focus on brain development and legal issues. There is a focus on the confidential sources of information and support, and we explain how alcohol and drug use may contribute to injury and violence, including dating violence. As I stated, we also had an amendment recently with respect to focusing on specifically heroin and opioid, but we expanded it to make sure that we include, let me read that. So the main motion was amended with respect to opioid and heroin use prevention in the 11th and 12th grades to introduce also alcohol, tobacco, including vaping, cigarettes, and other drugs of addiction. The primary purpose was to make sure that children did not ever take addiction as lightly, because in our opinion, any destroyed life, irrespective of the source, needs to be addressed.
As a follow-up to that, some of the other things that we're focusing on for the next school year, and we thank the Board of Supervisors, who have funded 6 prevention specialists, substance abuse prevention specialists, to help us, because as we begin to unpack the data, what we see is really clear. It's not so much the use, it's the addiction that comes when students have been introduced to using other substances like alcohol or marijuana. If you look at our youth survey, and our youth survey is only given to 8th, 10th, and 12th graders. So when you hear the data reported out on percentages, it's only a percentage of our 8th, 10th, and 12th graders who happen to answer the survey that year. For example, the 4.6% of the supervisor reference, that would be 4.6% of the approximately 40,000 students who answered our survey last year in 8th, 10th, and 12th grade. But when we look at that SAVE survey, we also see that alcohol use and marijuana use is much higher on that survey. And when we look at many of the studies out there, we see that they are showing that those are often predictors. So in the school system, we're not approaching it as simply an opioid issue, we're approaching it as a substance abuse issue. And we looked at the data over the last 3 years with regards to the youth survey, also our discipline data, and identified 5 high school pyramids that in 2018-19 will have these additional specialists assigned to. Langley, South Lakes, Herndon, West Potomac, and Robinson pyramids. In addition, we also have monthly seminars available to parents in the community that happen on the 3rd Tuesday of the month. They begin only during the school year, so they won't start up again until October. So the 3rd Tuesday of every month at Quander High School or Pimmett High School in the evening, we do have sessions for parents and community members that might want to learn a little bit more about what substance abuse prevention might look like, for whether it's your own student or whether it's something in the community that you'd like to learn more about. So we encourage you to come to those sessions that we have monthly. One thing that is promising for us is that we have been working on this area through the curriculum that Ms. Keys-Gamerra referenced, and our data, which we're never going to be happy when we have any students reporting use, but our data compared to the national data is much lower. The challenge that we see is on 8th, 10th, and 12th grade is where we take the survey. 8th graders are reporting very little, for example, 1%, and then by the time they're in 12th grade, it's up to 4%. When we look at marijuana use, 1.4% in 8th grade, 12th grade, 18%. Alcohol in 8th grade, 3%. By the time it gets to 12th grade, 30%. So we see that the high school is the area where we're identifying more and more, our students are self-identifying, that they are engaged more in these substance abuse issues, which is precisely why these new specialists targeting at our high school will be very helpful.
Thank you, Dr. Duran. A lot going on in our schools. Thank you for doing that. I want to just take a second and welcome Chairman Bulova. Thank you for coming. And from our school board, Timmy Duran Koufax from here in Lee District. Thank you. Anybody else I missed? Karen Corbett Sanders from Mount Vernon District. Thank you. Anybody else who feels self-important and would like to be identified? We're all important, right? There we go. Okay. I'm going to turn it over to Sergeant Waked right now, and then we're going to come back to Peggy Cook and talk a little bit about parents. But I want to ask the sergeant a little bit about the view on the street and what we see with narcotics in general and opioids in specific on the street, and then we'll have Chief Rossler give us some overview on that. And then we'll talk about how we fix the problem in 5 minutes, and we'll turn it to the next panel.
All right, thank you so much. First of all, I want to address what is an opioid. Opioid is basically, there's 2 different types. There's a synthetic and a natural opioid. The synthetic one are pills that are produced in a lab that mimic the actual natural substance. And that's usually like pills that you get for pain. It's all prescribed to you by a doctor. The other side of it is morphine. Morphine is derived from a seed from a plant, and from that they make heroin. And what that does is when it's injected into you, it goes straight to the opioid receptors in your brain, and it blocks pain. And when it blocks that pain, you also get a release of dopamine. Dopamine is a drug that satisfies you and gives you a euphoric feeling. And the issue with that is, after the user uses that enough times, the dopamine levels drop, and they're constantly chasing that same original high that they experienced. And what they usually do is they go to a different substance that is added into the heroin, which is usually fentanyl. Fentanyl is extremely dangerous. It's originally, I believe, used for an animal tranquilizer. And once that's added, and that's where we see the majority of our overdoses in the county. And that's what I want to make sure everyone is clear on that initially.
Your police department, like all the other police departments in the United States on the opioid crisis, is the tip of the spear. We get the 911 call, and as Secretary Moran pointed out, we cannot arrest our way out of this social medical issue. So our response here in Fairfax County, as a leader in the country with other departments, is to deploy narcotics detectives to the scene. Usually the 911 call is a medical emergency where someone has overdosed, and the fire department in most cases gets there first. They have Narcan to resuscitate those that have overdosed, and also community members can purchase their own Narcan. The police department did a pilot project on Narcan, and we have a great fire department that beats us to the scene because they are in a fixed location at the firehouse and could get there to save lives. So the numbers that were reported out by Supervisor Cook, they are staggering. But if it wasn't for a great fire department, I guarantee they would be at least double. So as the tip of the spear, how do we prevent this epidemic? Obviously, we talked about education. That's a prevention tool. Also, drop boxes for discarded drugs. We did a pilot project at the West Springfield Governmental Center, and we are expanding that project to the other governmental centers co-located with police stations, thanks to the Board of Supervisors and the county executive. And also, if you look at the numbers of the fatal overdoses we had in Fairfax County, each one of those is treated as a homicide investigation. And that has tripled the work of our homicide detectives, our crime scene detectives, narcotics detectives, and I am grateful to the county executive and the Board of Supervisors for authorizing additional staffing for us to combat this problem, just to keep pace with the epidemic. Lastly, data. We are grateful the partners here, also INOVA and other jurisdictions in the state, are sharing data, because we need to understand what the trends are in the Commonwealth of Virginia, and it knows no boundaries. Most of the drugs that we deal with in Fairfax County are coming from the Baltimore area. So we do work on a federal, regional level to combat this problem. Unfortunately, it is getting worse, and we're trying our best. So this team up here is just one great example of leadership in your county to combat a deadly problem. Thanks.
Thank you, Chief. And we're putting millions of dollars into this effort, but the key, I think, that you're hearing already is the teamwork, that it's a multifaceted approach. We've got police, we've got our school system, we've got our CSB, and there's one more element, and that is all of us, all of you, we can't be spectators. We've got to be parents, we've got to be caring community members, because this is a 100% preventable situation, but that doesn't mean it's easy because of the addictive qualities that we're talking about. But what can we do, Peggy, as parents? What can we do as community members to really make sure our kids understand just how dangerous this situation is?
Well, we've talked a little bit about education. I think that's going to be very important. But we want parents to be very aware of what the signs and symptoms of drug use are. They're pretty similar for opiates as for other drugs. We do see a number of 15-year-olds to 24-year-olds. In fact, that's the highest percentage of overdoses in Fairfax County, is that age range. We also are seeing a number of females. They tend to use the pills more than the males do. And in general, we want to make sure parents know what the signs are. So if you start seeing decreasing grades, secretive behavior, if you find shoelaces missing in your household, they could be using that in order to tie up their arms so that they can shoot the heroin in. Certainly burnt spoons. I would also tell you to please go on the CSB website. There's a ton of information there. There's videos. You can find out about the Revive trainings. Revive is the overdose reversal training. We offer those for free throughout the community every single month. We also have the ability to offer subsidized medications for families that don't have the money to purchase the medications. You just want to be involved. The CSB is always there in case you have questions. If you're not sure what's going on, you can certainly give us a call. We can help talk you through things. In the event that you do need treatment services, we are very blessed in Fairfax County to have treatment services that are available throughout the county. Not many other counties can say that, so we're very pleased about that. So if you are sensing something going on with your child, you're probably right. Check into it. The child's probably going to say no and be a little bit angry, but that's okay. Continue to reach out. Talk to people that are able to help. There's certainly peer support available for the children, and let them know that you are there, and continue to reach out.
Thank you. Okay, I'm going to go to our school folks now, and we've got about 5 minutes left, and Dr. Duran did a great job talking about how we're trying to positively educate our kids on the subject. I want to ask you to spend a minute talking to us about the disciplinary aspect. I want to make sure we all understand that there are disciplinary processes in school if kids are doing things they shouldn't be doing, and we'll talk a little bit about that, and then we'll finish up. We'll give the last minute to our police folks to wrap up the panel. Thank you.
Well, the SR&R does require that if there's a drug infraction, that it has to be, or there needs to be a referral to the superintendent. The principal can evaluate and determine if there were special circumstances as to whether disciplinary action, how that should be handled, but the student can also be assigned a 3-day alcohol or other drug seminar. From the school board standpoint, I'll speak more for myself and perhaps some of my colleagues that are very concerned about how our students have an opportunity to be rehabilitated. We would like, there are a number of us that would like to have emphasis on restorative justice, and so we've had extensive conversations about making sure not necessarily the children don't suffer the consequences, because there are obviously consequences, but that they have an opportunity to be available for learning as soon and as quickly as possible. So I would say a number of the board members have a particular emphasis on that.
Ms. Keys-Gamerra covered most of it, but the key here is we are required, if we do have students that are using illegal drugs or possession of them, back here, we are required to report that per the Code of Virginia to the police. So we do work with them on that. But we also look carefully to see, I'm not sure what's happening here, we do work carefully to see is what's really what's going on. So we work with our counselors, we work with our substance abuse prevention staff to see what is happening. Is this because we don't want to treat it simply as a disciplinary issue. We want to make sure that we're working with students to understand what's happening with them. And that is something I referred to, that we're happy about the new specialists coming back in at our high school level, but we have to understand not just reporting them, suspending them. That's not going to help when a child is really involved in an addiction. And so that's what Ms. Keys-Gamerra was referring to, the principal looking at those special circumstances to understand, and the 3-day seminar that goes along with that. And then beyond that 3-day seminar, students may need additional supports and help, and we will refer them to various county programs that are available, or try and see where we have in-school district counseling that we can provide for them. So it's a combination of the two. Absolutely report it to the police, but then also look at what's happening holistically with the child and their family.
Thank you, and we've got a couple minutes, so I'll give it to our police chief to wrap up, and just, I think the theme, obviously, we're here talking about prevention, we're talking about working with our kids to recognize these dangers. We do want you to realize and appreciate that there's help all along the continuum here, whether it's from the CSP, schools, county, and so if you recognize those signs in your kids or in your neighbors or friends' kids, please say something. Please reach out to us and let us help. We want to prevent, and then we want to also capture as early as we can, use so we can turn it around before someone becomes that statistic. Chief, I'll give you the last word here.
Well, again, with this great partnership that we have with all our stakeholders, the last thing we want to do, especially with school-aged kids, is to arrest our way out of any problem, whether it's opioids or discipline issues. We're very aware of a school-to-prison pipeline theme throughout the country, and as mentioned, the alternative accountability program that we started up with our juvenile court, partnered with the schools, CSB, and others. Our numbers for entry into alternative accountability, that is not putting children into the justice system, are growing, and our arrest data is shrinking. Unfortunately, we do have to make arrests because sometimes there's a petitioner that wants to prosecute. That's not in the hands of our discretion when there is a victim. And clearly the opioid crisis also, we try to be good Samaritans, as the sergeant mentioned. We investigate each and every overdose, but the last thing we want to do is arrest someone with a medical addiction. We want to go after the suppliers. So in both cases, we're trying to cure the problem: prevention, education, rehabilitation. Thank you.
Great final words, Chief. Thank you very much. Thank you to our panel. We've got 1 minute. We're going to turn back to the general order to let the everyone get up here for the next panel. Thank you for being here. Secretary Moran, you are up, and thank you very much for the opportunity to talk.